Prime Minister Dr. Terrance Drew believes crime should be viewed as a virus which infects an organism and wreaks havoc on all its systems. As a result, his administration has adopted the novel strategy of addressing crime from a public health perspective. With his government's all-of-society approach considered, Dr. Drew believes that in addition to treating symptoms of crime, such as violence, preventative measures that strengthen families, the building block of societies, must also be implemented.
We have recently approved in Cabinet the National Drug Policy, which took some time to develop. It's a robust policy because part of the issue is if you have demand for drugs, drugs will come. Somebody will find a way to do it. And with drugs come guns and so forth. If you can deal with it from that perspective, these persons who might be vulnerable, especially children, through that policy can help to prevent drug addiction. And that's helping it. One, because it does not propel the trade. And secondly, we know that people who use drugs are prone to be victims of violence and also can be perpetrators of violence as well. So that's one, comprehensive. We're actually going to build a building that deals with drug use prevention and also deals with issues of mental health. Significant investment. The second one is that we have just trained 20 plus new family counselors. 20 plus, the highest number ever by far in St. Kitts and Nevis. These family counselors are to go to families that are experiencing stress and difficulties, to intervene, to see how they can resolve these issues. And we intend to train more family counselors because we want them all through the country so that we can capture wherever the issues are. Thirdly, we have hired the most mental health professionals ever in our history. We have mental health professionals at the hospital. Psychiatry has 2 psychiatrists. We have a psychologist who has a PhD. And plus we have employed more persons in the school counseling program, within also the social services in terms of persons who are equipped to deal with issues of mental health. And we are, of course, collaborating with the private sector as far as those type of services are concerned. Again, having these type of professionals to deal with early issues of the family dynamics, children who are affected early, to help them to resolve some of that trauma so they don't become dangerous adults, is a significant move in the right direction.